Hello, hello, Doc.
Hello, how are
Welcome.
you?
Welcome to my favorite chiropractor in the entire world.
Thank you.
I want to introduce myself and then I'll introduce you. Everyone, I am Charmaine Reeves. I am the CEO and founder for Angels Are Networking, and we are a company with the best members ever, including Dr. Alan Gilenson, and he's been a founding sponsor for a while, but we really focus on helping entrepreneurs who are across the spectrum, corporate business, corporate executives, medical doctors, as you can see, celebrities, everyone who has a small business that they want to help, that they want to grow, and they want to get access and network to other folks and build their client base and revenue. That's what we do here at Angels Are Networking. And I am so honored to have the esteemed Dr. Alan Gilenson, chiropractor, here in the Suwanee, Georgia area. He has taken his time, and I know it's very valuable. And so I'm very appreciative. Dr. Allen, welcome again and greetings to you.
Thank you. Welcome.
So I am going to introduce you not only as a friend, because you've been the chiropractor for myself and for my 3 sons, and they love you almost as much as I do. But even though they're grown and the ones are in college, I know my youngest son, he comes home from college during the summer, and one of the first things he does, he's got to come and see you, Doc, right? You have been a licensed chiropractor and sports specialist for 30 plus years. And I love the sports specialist part of your bio, because that my 3 sons were all athletes. One of them even turned pro. And it was very comforting to know that when they come to see you, you were literally experienced and an expert in this, because you have been to the NFL Combine 3 times, and you have also worked with many Super Bowl players and several other pro athletes across the spectrum: basketball, football, every other type of sports. And what I especially, I love so many things about you, right? But what I also loved about you is because as my sons were youth players, whether they started in rec league throughout to the competitive level in Atlanta United or so, the confidence that I have in your experience and your caring about them as an individual person, and in terms of your advice during injury time, when you would let me know how they should deal with the coach who may want to put them back on the field too early. You are really and seriously an amazing person that cares for each of your patients. And I believe, and I know that one of the things you believe in is that people in general, whether they're in sports, they do not deserve to live with pain. And you've made that your goal. And I know you are proud to help people heal after any accidents they may have or any type of injury. So it is my honor to get started by asking you to share with us, generally speaking, what are some of the services that you offer at AMG Wellness Center?
Okay, well, thank you very much for that introduction. It was very nice. I appreciate it. And you pretty much covered a lot of my time. I've been in practice 30 years in Suwanee, or 28 years in Suwanee, and live here in Suwanee too. We treat things, musculoskeletal conditions are our biggest form of helping people, but we help migraine, headaches. I mean, there are a wide variety of things that relate to the body. If you keep the body mechanics working right and corrected, your body can help itself, and you can help a lot of things, musculoskeletal and others.
All right. And what I really must mention is that there are a lot of chiropractors around. Some of them just do only the chiropractic adjustments, and especially, I won't name any names, especially the newer, more modern ones that are popping up everywhere you go in. They do an adjustment and they let you leave, and you're not feeling any better, right?
Yes,
and
I'm kind of a dinosaur.
one of the things I love is when I come to your center, I can come and relax, close my eyes, or read a book, or check my phone laying down, because you offer some of the best therapeutics. All right, I know you do cold lasers and the electrical muscle stimulation.
Yes, we have a wide variety of STEM. I also do a lot of soft tissue work, which is where the athletics come in. And not only pros, but everybody. I love treating young kids that are young and injured, because we try and help them learn how to help themselves not get injured again. If we can give them things to do, that's part of what we do. We don't only correct the injury, we try and also help the person prevent the injury from happening later on in sports. And we try and help people just keep moving, exercising. We help with a lot of other things. We also, by keeping the adjustments and manipulation of the spine, keeping it aligned and healthy, your body got a better chance of helping itself.
Yes, fantastic. And I guess the Graston technique, when you said you work a lot on the tissues.
Yeah, soft tissue technique is one used as many as Graston, as people know of, all kinds out there. I use Graston active release technique to help the body, to help the muscle tissue in injured areas that a lot of athletes get, and people in general who are just trying to stay healthy. From running 5Ks to doing just brisk walks. It all can injure the muscle tissue. So we do a lot of soft tissue work. It takes time. And that's why I say I'm more of a dinosaur these days. I don't do rack them, crack them, and you're out. We really look over the whole patient. And if we need to refer out, we refer out. If we see something that I can't handle myself, I have a network of people to refer out to, from functional medicine to orthopedists to neurologists. So we try and help people in every way.
I love that. In fact, I have someone, I want to set you up, another member of Angels, the founders for Elite Medical Center that I told about you. And I think you'll find that you guys will make great business.
I love to meet people.
I'll set up that introduction. All right. What are some of the common illnesses that you find the people coming to see you? Are those the most common, you think? Are those migraines? Are those back pain?
A lot of them are back because of being a chiropractor. They think of spine right away, but I have dealt with migraine headaches very well. We have dealt with, other things that relate to the muscle and the skeleton, vertigo. I also do extremity work. I also work on, shoulders, knees, ankles. I've worked on everything in my time in the years past. And they all get help from manipulation and soft tissue work. I just feel the combination works the best for people. And we use therapies such as decompression for your low back if you have a herniated disc. That's another thing we treat, bulging disc. You don't have to suffer in pain. You don't have to take a lot of pain medicine. I'm not against it, but abuse of it is not good either. So the more you can do with icing, heating, stretching, exercise, advice that we can give our patients, and we do every day.
Foam rolling, you always tell my boys.
One of my favorite things I do every day. I come in and I leave my office, I foam roll. It keeps the blood flowing into the body, and it helps the body help itself. Yeah.
Let me ask you about another therapeutic that it has become really a big deal, which is like cryotherapy. Does that help with pain also? I think the buzz around it from the industries, it helps with weight loss. So if someone comes in to get cryotherapy for pain, maybe if they were trying to lose weight, it might also be a side benefit.
I mean, there's a lot of things out there. I'm still looking at a lot of things myself. I don't get into too much. Ice is great. I love using ice on the body after an injury, heat, to warm yourself up before you play or you go do some activity. Cryotherapy, there's a wide variety of different things that are out there in the field. And I try and keep up on everything I possibly can. But there are some things that, I mentioned about it. I try and keep it musculoskeletal.
And the ultrasound is good too. I mean, everything is so great.
Deep penetrating into the body, helps break up again the adhesions, all the bad tissue that we're trying to help somebody to heal the right way when they exercise.
Coming to see you is like a treat. I just want you to know, when you walk out of there, I tell you, you feel so great. And talking about coming to see you, I have been experiencing some dizziness, and it's the timing, I suspect, maybe allergies or sinus infection or something. But you mentioned vertigo earlier. And so will me coming into you and getting an adjustment kind of helps do, you know, central nervous system?
If the vertigo, if the vertigo is related to something that is musculoskeletal, I can definitely help it. If not, I will definitely know that after seeing the patient, evaluating the patient. And then we can also talk about other options. But yes, we can help a wide variety of things with, like I said, migraines and headaches, you know, muscle tension headaches, all those things that people just think they have to put up with. They don't have to. Sinuses even, you don't have to. Adjustments can help open up the sinuses a little bit and help the body clear out.
Yes, that is really good to know, because I wanted to chat with you today just to help the community, help the audience understand that a lot of the common things, or not even the uncommon ones, they're all spinally connected, right? That's the topic.
Correct, right. Like sciatica, people think it's in their leg only, but it's in the back.
From head through the back down to the toes, all connected. The spine is a very important, I don't know, is that an organ? That's not an organ.
Well, system. It's a system, musculoskeletal system. The body works together. You can't separate muscle and spine, you know, joint, because they work together. Everything, bones, joints, all work together, and they help each other out. So if one's not working right, something else has got to help out. And that's where we see a lot of repetitive motion injuries, which is very common these days. Carpal tunnel injuries. Those are things that we can help. Tennis elbow. You know, those are things that people don't think they have to just deal with or just take ibuprofen. You can get that resolved. You can help those conditions.
That's good news. Someone is listening and go, great, that is good news. You know what I want to ask you about, though, that I know everyone listening is going to be nodding their heads in agreement with the whole COVID-19 pandemic thing. Two things that I hear a lot. A lot of people are really, really stressed, like stressed out for everything, for every reason that is a valid reason. And I assume, and I'm guessing, because of all that stress, some people have insomnia, having difficulty sleeping. Can you talk about those how maybe that chiropractor could help with their own natural healing with that? And one other thing, Doc, and any of the resources or the tools, like those chiropractic pillows, explain that. Would that help with sleeping if people are
yes and no? I'll try and explain it. Sleep is important. We have to get sleep. So if you exercise and, you know, chiropractic adjusts the spine and helps manipulation, move the joints and helps the nervous system work. So if that's working better, the body can then sleep. You know, sleeping helps everything else heal. So if you can't sleep, that means you can't heal. So by us manipulating the spine, helping the body help itself, you get better sleep. Now, there's different ways of sleeping. You don't want to sleep on your stomach. That way is no good.
I got to tell that to my husband.
Yes, it turns your head and you hurt your neck and back. You sleep on your back with pillows underneath your knees. Is the most comfortable way for your sciatic nerve not to be stretched. And then you can sleep on your side with your knees bent, with a pillow between your knees so you don't bend again, straighten out the sciatic nerve. So you're bending it, you're giving it some rest. And the cervical pillows are good, but you got to also watch if they're too much of a curve. Yes. You want something in that middle to keep your head straight.
Yes.
So that's the best way to put it. So you don't put your arm over your head like this to sleep, because you compress the nerves in here.
Oh my gosh, you are helping like
millions. So there's simple little things that people can do just to help themselves when they sleep.
You are helping millions of people get a better good night's sleep tonight, including myself, because I have not been using those pillows, and I'm going to prop my knees up. That is really...
Yeah, they work. It really takes the pressure off the back, and it makes it feel a lot better.
Yeah. Okay, so let's shift a little bit. When a new patient comes in to see you, I know from previous experience when we mentioned chiropractor, the people, they may have gotten a bad rap initially that chiropractors never end. Like they would be continuously having to come in for an adjustment like year after year or so. I know better, but I'm going to pose a question to you that you're not that type of a chiropractor.
No.
Can you let me know if you would be able to, after a consultation with a new patient, be able to give them a good indication of approximately how many sessions or treatments they would need?
Yes, it depends on what we have to do. We have to do x-rays. We do them in the office. So we do digital x-rays in the office. I do a full orthopedic exam, chiropractic exam. I find a lot of things out in the history, talking to people, finding out about their lives and what's going on. Maybe something else they don't even realize is going on that I can point them in, either helping it or point them in the right direction. I go 2 weeks at a time with people. A lot of my care plans, I like to see how the person progresses. As time goes on, we treat them, and then we reevaluate about lifetime. Well, I'll tell you, I'm 60 years old, and I do get adjusted.
Oh, Doc, don't tell your age. You don't look 60 at all. Don't tell anyone that.
But I do get adjusted when you need it. And if you be proactive about it, you don't need as many treatments as if you're reactive and you hurt, and then you got to get treated. So there's a lot of philosophies, a lot of different ways of thinking. But I do evaluate in the first 2 weeks. We will, see how the patient does and reevaluate, and then treat accordingly.
Okay. Well, I know I have to set an appointment. I mean, this has been fantastic. I've got to set an appointment to work on my vertigo, and I am going to get the best sleep tonight by doing my pillows.
And it's always good to ice at night and heat in the morning or afternoon when you get going. Just to give that, I didn't mention that.
No, that it's fantastic. And I just want to say to you that, again, I am not just saying these words. I back them up with my action, and my whole family coming to see you.
Yes, you did.
And I want to share with everyone that I encourage them, if they're in the Georgia area and the surrounding Sewanee, Alpharetta, Roswell, Marietta, it is worth a trip, guys. Drive past all those other chiropractors and come and see my favorite chiropractor, Dr. Allen. And we are at a time, we're wrapping this up, Doc. So for any of our Angels members who comes and book an appointment with you and come and see you before the end of May, do you have a great giveaway?
Yes,
we can offer
we would love to give them a free foam roller that is great to use, and I use it every day of my life, and it keeps me, the blood flowing. So if you set an appointment up, mention your company's name, we'll be glad to give them a free foam roller.
Oh, thank you so very much. And guys, my kids fight over foam rolls. Okay, they actually have to have one in their bedroom and in the common area, and they're like, who took the foam roller? So so that is so generous of you, Dr. Allen. So I really appreciate that. So Doc, we are at the end of our segment.
Well, thank you very much.
Thank you so much for your time. I really know how busy you are with your office services.
Anytime for you.
5 days a week, right? Monday through Friday.
We're open late Monday, Wednesdays, and Fridays. And Thursdays we took off from COVID. We're trying to get back on again.
Okay.
But right now we're closed for appointment only on Thursdays, but Tuesdays we're there, and Monday, Wednesday, and Fridays we're there late till 7 o'clock at night.
Wonderful. Thank you so very much, Dr.
Thank you very much.
Allen
you have a
Gilenson.
great day.
To the audience, thank you. And I don't even have to ask. I know that you have learned a few really great nuggets today that you can take away. Go book to see Dr. Allen, and take care, everyone watching this. You guys have a blessed day. Thanks again.
Thank you. Take care. Bye-bye.
Bye.